50 and beyond. Aging gracefully.
Maintaining your physical fitness and mental well-being is crucial to living a longer and happier life. There are about 24 tests or screenings older adults can get to help ensure health and wellness. Of course, exactly which test you need depends on a variety of factors, including your age, weight, sex, family history, and risk factors, as well as on your doctor's recommendations. People are living into their 90s independently and in the community and loving it. But in order to get there, you've got to do this stuff. Preventive screenings are always an important part of taking care of yourself, but they become even more essential to your well-being as you grow older. Why? Because older adults are at a greater risk of conditions that develop slowly and don't always cause noticeable symptoms such as high blood pressure and colon cancer. Here's a rundown of important routine tests you should get as an older adult. 1. Eye test. Eye health may decline gradually as people get older, but the changes may not be noticeable right away. Poor eyesight can affect your ability to drive, get around the house, and perform daily tasks. Also, as you age, the risk for eye problems such as cataracts and glaucoma increases. 2. Hearing test. Get your hearing tested and get a hearing aid if you need one. If you have hearing loss, you have a greater chance of developing dementia, according to a 2020 Lancet Commission report that listed hearing loss as one of the top risk factors for dementia. 3. Dental test. Gum disease increases the risk of a heart attack. That alone should get you to the dentist. But gum health can also be a good barometer of your overall health. Your teeth, gums, mouth, and throat need to be checked by a dentist, ideally twice a year. 4. Breast cancer screening. Screening for breast cancer has been suggested to begin before age 40. Women up to age 75 should get a mammogram every 1 to 2 years, depending on their risk factors. Risk factors include having started menstruation before age 12, a family history of breast cancer, dense breasts, and genetic mutations. After age 75, women should discuss the need for continued breast cancer screening with their doctor. 5. Bone density test. These tests are the only way to diagnose osteoporosis and the only way to screen for osteoporosis before a bone breaks. These tests can warn you if you need to take action to improve your bone density and help you track whether your bone density is holding steady, decreasing, or improving over time. Women 65 or older and men 70 or older, or anyone who has broken a bone after the age of 50 should have a bone density test. 6. Prostate cancer. This is a common disease among men, especially those between the age of 40 to 60. Doctors can check for prostate cancer with a physical examination and a blood test. Some signs of prostate cancer include difficulty urinating, unexplained weight loss, or blood in the urine. 7. Colon cancer screening. Colorectal cancer is more common among older adults, with an average age at diagnosis of 68 for men and 72 for women. If you experience changes in bowel habits, abdominal pain, or bleeding, see your doctor. 8. Blood pressure check. 1 in every 3 adults has elevated blood pressure, which is known as hypertension. According to research, 64% of men and 69% of women between the ages of 65 and 74 have high blood pressure. Hypertension is often called a silent killer because symptoms may not show up until it's too late. It increases your risk for stroke or heart attack. This is why it's essential to have your blood pressure checked regularly or even daily. 9. Vitamin D test. Many adults are deficient in vitamin D. This vitamin helps protect your bones. It may also defend against heart disease, diabetes, and some cancers. You may need this test performed annually because as you get older, your body has a harder time synthesizing vitamin D. 10. Blood sugar test. Diabetes is a chronic illness that can only be treated rather than cured. But the sooner you start treating it, the better off you'll be. And if your blood sugar levels are in the pre-diabetes range, you can still work to lower them before you develop diabetes. It's important to test your blood sugar at least every 3 years if you have no other condition or risk factor. 11. Blood test. A lot of tests are technically blood tests. Blood tests can help measure everything from cholesterol to kidney function. But the health of the blood itself is important too. A complete blood count, CBC, can help you catch conditions like bone marrow issues and anemia. Having a complete blood test performed every 5 years or so is a good baseline, though if your doctor recommends one sooner than that, it's probably a good idea. 12. Cholesterol screening. Another important blood test is your cholesterol screening, also known as a lipid panel. Knowing your levels of HDL and LDL, that is good and bad cholesterol, can help identify potential heart problems as early as possible. You'll have to fast for 12 hours before the test, but it's more than worth it to catch danger to your heart or coronary artery. People at risk should get a cholesterol screening about every 5 years. If you have certain risk factors, you may want a screening more often than that. 13. Kidney test. Kidney diagnostic tests measure your kidney function by checking the levels of certain waste products in your blood. Most kidney function tests should be performed every 5 years. But if you're experiencing any symptoms of kidney disease, such as swelling in your extremities or bloody urine, a kidney function test will be an important part of the diagnostic process. 14. Thyroid stimulating hormone screening. Sometimes the thyroid, a gland in your neck that regulates your body's metabolic rate, may not produce enough hormones. This may lead to sluggishness, weight gain, or achiness. In men, it may also cause problems such as erectile dysfunction. A simple blood test can check your level of the thyroid stimulating hormone and determine if your thyroid is not functioning properly. 15. Pap smear. Women who are young and older need a regular pelvic exam and pap smear. Pap smears can detect cervical or vaginal cancer. A pelvic exam helps with health issues like incontinence or pelvic pain. Your older years can be an important, vibrant time of your life, so it's important for everyone to get regular medical checkups. Staying on top of your regular screenings can help you catch early signs of disease and seek treatment or even preventative care as early as possible. Incorporating this test into your routine medical care is a great way to understand your health and can help you treat problems as soon as they start, when the odds of beating them are at their best. Please don't exit this video without subscribing. Just click on the button in front of your screen right now. Like the video, drop a comment in the box, and share this video with everyone that it will benefit. I am Jumoke Michaels. Thanks for watching and keep aging gracefully. Bye.